Hi runners, Steve and Margot, podiatrists and running coaches from Intraining Running Centre, where we help runners manage their running by providing training programs, the right footwear, injury advice and rehabilitation management strategies. Keeping you on the road is our highest priority so that you can work to achieve your goals and to have as most fun possible you can while running.
And today we're going to talk about a very common traumatic running injury, which is ankle sprains. You're going to learn how to treat and prevent this common injury.
Yeah, we had one of our runners recently, unfortunately, roll her ankle while in the Sunny Coast half marathon, and it was only 5K into the race.
Yeah, she's done all this training the whole year just to make it to 5K, so that was a pretty tough decision for her to make, to stop running. And that's really the thing that you have to do when you sprain an ankle, is you have to sort of have a proper analysis and evaluation of how bad was that sprain, can I keep going?
Well, she did the one thing that you all should do if you do roll your ankle for a moment, and that is stop.
Yeah, and there is this thing called the Ottawa ankle rules. I have a little app on my phone actually with the Ottawa ankle rules, and it basically is a way of identifying whether you need to get a x-ray or not. And some people can sprain an ankle and, you know, it hurts for a few steps and then they can keep going. But most people, that's not the case. If it's a bad enough sprain that's actually ruptured something, you need to be able to know that. And so there's a few little spots that you look for to see if there's pain. So it's on the tip of the ankle bones, and then in the foot, it's on the side here and on the side here. And then if you can't take more than 3 or 4 steps without it hurting.
That's actually probably the very first one to do in the test, is to take those first few steps. And if you can't walk, you know, that's when you need someone to carry you off and then get yourself an x-ray.
So the interesting thing is that when you're older, you're actually less likely to fracture, but more likely to rupture a ligament. So that avulsion of the ligament off the bone, that's very common in children. So with that Ottawa ankle rules, anybody who's a child has to get an x-ray anyway.
So Steve, what's the general treatment that you do when you have a patient come in following an ankle sprain?
Well, the first thing that you have to do is actually do the proper diagnosis. And there's an acute diagnosis, but often you'll have to do imaging. So if you do the imaging, you're looking for that fracture. I've had patients in this last year that have actually fractured their foot. So they've actually fractured this little bone here. That actually takes a bit longer to recover. She actually had to have surgery after fracturing that. But in a clinical sense, we also look for other things. So other than, you know, where it hurts, you look at whether there's any bruising, because bruising indicates that something ruptured, and often bruising pulls down the bottom of the foot where it's not actually sore, but it pulls down there, and that's an indication that something's ruptured. The blood sort of flowed down with gravity and then pulled at the bottom of the foot. So that's the number one thing, and the most important thing really is to have a proper diagnosis of how bad that ankle sprain was.
Then what's your next step?
Well, you really want to make sure that you're protecting it. So there's the RICER, sort of PRICER type of acronym for treatment. So the PRICER, the first point is protection. And that might mean non-weight bearing. So for some people it's going on crutches. For some people they have to go in a boot. For other people it can be strapping. It can be just reducing their activity. So you try not to walk as much, you don't run for a while. You know, it really depends on the person. There's even ankle braces that you can get, which are quite useful. So there's all these different sort of stage amount of intervention to try to protect it, to stop you spraining again.
But as Steve mentioned, most ankle injuries that occur are not fractures. They are disruption to the ligaments and the tendons around the ankle. And so a lot then is getting into quickly into an active rehabilitation program.
Yeah, so you need to try to mobilize it. And a lot of that is having that staged as well. So for the ankle sprain patient, we created a a rehabilitation program right away where she was learning the movements and the exercises, which was really pretty simple. It's just doing that and rocking to the side and making circles. And she did that non-weight bearing and then semi-weight bearing and weight bearing and then weight bearing on one leg, and you sort of all the way through. And if you're in a team sport, it might be necessary for you to do actual functional type of exercise before returning to sport. That might be able to jump sideways and catch a ball on an uneven surface, to be able to do that and not hurt your ankle.
What you're trying to do as you're going through the rehab program is regain the strength in those ligaments and tendons, but also to regain the sensory receptors that are there that cue in to when you are going to roll your ankle. So mechanoreceptors sit in the ligaments and the tendons, and they respond to change of movement. So particularly anyone who's trail running at the moment, you've got a lot of that happening all the time. And so those mechanoreceptors are working very hard to make sure that they respond appropriately and you don't roll your ankle. When you have an ankle injury, those mechanoreceptors their function is disrupted. And so a lot of the programming of what you're doing is retraining those through a lot of balance work and proprioceptive work.
So you're really connecting your brain back up to those mechanoreceptors after they've been disrupted. And it really doesn't take very much time. It's about 2 weeks of doing it for maybe 10 minutes every second day. And that's enough to actually relearn that movement. But you have to sort of be at a point where you're not going to be hurting it again to be able to do those.
So there's different reasons for having ankle sprains. There's one, it's just a pure incident, which is what happened, unfortunately, to our runner, and happens at times in the trails. Another reason is that if you have a hypermobile ankle, then there is a chance that you're more likely to roll over. Sometimes if you have a hypermobile ankle, then you can recover quite quickly as well, because you have a tendency to go over and Steve will be back up running. Whereas if you've got a stiffer ankle like mine, when I roll my ankle, it's almost a guarantee that I'm out for a few days to a week, providing I do the correct rehabilitation process. There are anatomical variations with your feet that can actually contribute to making you more susceptible to rolling your ankle. So it's learning to understand, what are your biomechanics, what's your anatomy, how does all that structure fit into reducing your chance of having an ankle sprain.
So when you come into the clinic to see us, that's really what we do, is evaluate all of those factors that have contributed to an ankle sprain. And sometimes, as Margot said, it's just bad luck. But other times it's because the person hadn't rehabilitated a previous ankle sprain properly, or they have those structural issues in their feet. And that's where orthotic intervention or footwear modification or just footwear prescription can make a big difference.
So if you haven't sprained your ankle, that's absolutely fantastic. But if you know you're going into the trails, it actually can be really good to step into a little bit of an exercise strengthening program for your ankles. And that way you can give yourself a better chance to not hurt yourself if you do happen to roll your ankle. So there's a lot of little things that you can do to contribute to reducing your chance of getting an ankle injury, and also to regain strength if you have had past ankle injuries.
And the interesting thing about the trail running is, while you're doing the trail running, there's definitely an increased risk of spraining your ankle, but actually doing trail running is one way to get more strength so you don't sprain your ankle as much, because you're getting a more uneven ground, you have to adjust to it a lot, and so it's actually developing that strength out of a consistent range of motion.
So keep safe while you're running. Get the strength that you need, make sure you've got the right shoes, make sure that you're giving yourself that best chance possible when you're running off-road to have a really enjoyable run. We'll see you again soon. Oh, if you like our run talk, make sure that you comment below, share it to your friends,
subscribe
to our YouTube channel. We would and give us any questions that you would like. We'd love to answer them for you. Enjoy your running.
We love running.